welcome to Skincare Confidential, the podcast supporting the Science of Skincare Summit, an educational event occurring in Austin, November 8th through the 10th in 2024. Listen, my name is Dr. Ted Lane. I am a board-certified dermatologist. I am the co-host of this podcast. I'm also the co-founder of the summit. But enough about me, because I am so excited to present my guest, Dr. Evan Reider. Evan is amazing. He is a board-certified dermatologist and a board-certified psychiatrist. He is in private practice in New York City. He is sought after by the media. He publishes, and he's a deep thinker. So I'm super excited to have Evan on our show. Evan, thank you so much for being here.
Ted, thank you for having me, and thanks for the warm introduction. I hope I will live up to the billing.
Of course you will. So, Evan, listen, you do a lot in skincare. You know, you do a ton in kind of that intersection of psychiatry and dermatology. And thank you so much. I mean, there are very few of you that have the double board certification, and you really lean in and try and educate your peers on that, which we all are super thankful for. But you also kind of take that and apply it to skincare. Just kind of talk to me about how you kind of think about how skincare can be beneficial in terms of that intersection of psychiatry and dermatology as well.
Yeah, sure. So it's a long topic. I'll try to keep it as brief and as broadly applicable as possible. So when I was a medical student, I thought I was going to go into psychiatry, and then I did another rotation in outpatient dermatology, and it's all outpatient dermatology pretty much. But and I was like, I really liked it. I liked the quick diagnosis. I liked the fact that people were doing surgical, medical, and cosmetic, and you can see adults, you can see kids, you can do it all as a dermatologist. But what I noticed when I was going through the dermatology practices, there was so much overlap between the way people were looking, and whether that was something aesthetic or that was an inflammatory condition of the skin, or if they had skin cancer, and the level of anxiety or mood disorders that was going on in our patient population. So that got me thinking about there's got to be some way to sort of wed these two fields together. And I think the way that my career has gone has really been, I've become much more of a clinical dermatologist, although I still see patients with psychiatric disorders and the same time having skin disorders. But I've really been leaning into the skincare thing and for like the aesthetics and the confluence of aesthetics and psychology, because it's so broadly applicable to the general population. And skincare in general is not an area that I ever thought I would get into, but there's so much interest from skincare companies and from really young people. It was first millennials, who I guess are not so young anymore, but you know, Gen Z, Gen Alpha are much more wellness oriented. They're much more mental health focused, and they're much more holistic when they think about their own healthcare, and that goes for skincare for sure. So, a lot of what has come in terms of my work as a consultant and as an educator for our peers and for people in industry has to do with figuring out how to meet the consumer and getting people the most value from the skincare, even beyond like having nice looking skin. And that, I think
Yeah.
that's where the confluence of psychology and skincare is. And go ahead, sorry.
Well, no, I'm kind of taking that a step further, because I can tell you, you know, when I use the skincare that I use at night, it's a form of self-care for me, for sure. It's kind of me stepping back and saying, you know what, I'm taking care of myself. I feel good about this. And it is a ritual that if I don't do it, I actually feel bad about myself that I didn't do it. And so I can identify with what you're talking about in terms of, you know, skincare. Just the act of applying skincare is sometimes, to me, it might be just as important as the products you use. Is that something? Is that
Yeah,
valid?
yeah, and I think so. And I think interesting, like I have a lot of ideas about studies to ways to validate this. No one's really done it, but I know how I would do it, and I may actually end up doing it. And if someone's interested in working with me on it, I'd be interested in doing that too. But what I would say is that what you said is like spot on. You know, when you look at the skincare in general, most of the studies are pretty weak. There are some
Hmm.
exceptions, and
Yeah.
you know, SkinCeuticals comes to mind. It's like the gold standard for doing skincare studies. But I think that that mindfulness activity, that mindfulness experience that people get from skincare can be exceptionally valuable regardless of what they put on their skin, assuming that it's something that's not causing irritation or some sort of inflammatory reaction. And I think that that's sort of everyone's busy in their life to different degrees for different reasons. And I think that everyone's looking for that 1 minute, 5 minutes, whatever they can get in their lives to attend to themselves and like, this quote unquote self-care moment. I think that's definitely what skincare is. It's and for some people that's one step, for some people that's 5, 8, 10 steps, whatever they want to do. But it's tactile. You feel it on your fingers, you feel the
Yeah.
texture, you're putting your fingers on your skin and you feel the texture of your skin. The sensorial quality of the products, I think, is really important for some people. Fragrance is really important.
Hmm.
Even the packaging is really important. The aesthetics of the packaging, the way the package feels, the weight of it, all this is like, I think, very interesting and very alluring. And I think that's all part of the psychology of skincare. It's all sort of wrapped up in one. But I do think it's a way to stress relieve, get in touch with the moment in a way that for a lot of people is much easier than doing something like yoga or Pilates or meditation,
Hmm.
where I think those things can have like a very sort of high ramp to get to the point where you're actually finding the benefits of it. Skincare for some people can feel like it's instantaneous, and I think
Yeah.
that's super rewarding.
I think that there's a psychology of selling products, but we're not talking about that. We're not talking about like what packaging is more attractive to get people to grab that product from the shelf.
No,
Just to clarify to people, what we're talking about is the psychology of what the package looks like, how it smells, how it feels, to make the user literally feel better, to change your mood, to change your perception. And there's a lot more work going on in that field, right, Evan?
there are a couple companies that are doing some interesting work there. There are several companies that are doing less interesting work, and I won't,
Mm-hmm.
throw anyone under the bus. But I think the whole, and when I was talking about packaging, I was just feeling like I was talking about like the sort of the consumer experience of living with
Yeah.
the package. Sometimes the way it looks, sometimes the way it feels, but especially the way the skincare feels as well. And when we think about our work as dermatologists, like these are things that we don't really learn about or really talk about, but it's really important because as dermatologists, we give medications away to people sometimes without really thinking about the vehicle that they're in. And a lot of the pharmaceutical companies that make our drugs that are so important are not as attuned to this. And like people don't want to use those products. They don't make them feel good. It's like a greasy
Mm-hmm.
ointment or it's something that has
Mm-hmm.
some sort of like texture in it or it doesn't feel right. So I think a lot
Mm-hmm.
of the times skincare can give people that added sensoriality, even if the clinical benefits may not be as robust as getting a prescription medication.
We have never talked about this, Evan, and so if this is not something that you're familiar with, please tell me and we'll move on to another subject. But I've been reading more and more about adaptogens in skincare, which, from my understanding, adaptogens are usually naturally based ingredients that help you deal with a stress response. And so, for example, they're usually applied in a nighttime application, and they reduce the stress response of the skin, which can reduce inflammation and kind of allow better use of antioxidants in the morning. Like they just have multiple applications. Does that resonate with you at all? The adaptogen type
So
ingredients?
I took a while back, I saw people talking about that. And so I took a little dive into the literature, and there really wasn't that much there. And I felt like it
Okay.
was, for me, it was a lot of smoke and mirrors. And I think that it's a sexy topic to the general public because it is sort of medication free and it sounds
Yeah.
more natural. It sounds more
Yeah.
holistic, but I haven't been blown away with by anything that I've seen. There are ingredients that we know, and they're not that hard to source, that can actually block some of the stress response that happens in the skin. And we know that there's, the cortisol is active in the skin, just like
Hmm.
the such stress response has cortisol. And I think ingredients like that are more intriguing to me, not because it feeds back centrally on the body, but we know that the skin, unlike any other organ in the body, is has like a little stress response, like a microcosmic stress response of what's happening internally. When we get stressed out, our brain goes haywire, our nervous system goes haywire, our hormone system goes haywire, and they sort of all interact with each other, and then they can feedback on every internal organ, and like any organ system can pretty much get inflamed. And then the same thing kind of happens on the skin in like microcosmic form, and no other organ can do that. So I think for me, like targeting those with like molecules that we know can really block stress responses that have meaningful effects, whether that's on aging of the skin or even
Yeah.
on inflammatory conditions like acne,
Uh-huh.
that becomes more intriguing to me.
I want to go back to something you touched on, which is kind of the pharmaceutical topical products and how historically they have just really not paid any attention to the vehicle, not paid any attention to the delivery system or the elegance or use of the product.
Hmm.
But certainly recently they've been listening to you, and you could see that kind of that Venn diagram of one circle of pharmaceutical products, the other circle of skincare. They're kind of
Hmm.
overlapping now,
Hmm.
right? As the
Yeah.
pharmaceutical formulators start getting the idea, and they need to start borrowing ingredients and formulation ideas from the cosmetic space, which we've actually seen happen in some of the latest topical formulations. And I know there's a lot of pharma people that listen to this podcast, and so, you know, work with Dr. Reider. He's giving you this idea of he's really involved in this kind of sensoriality, the idea that you can take a topical product and enhance well-being. In my view, there's no reason for even a topical therapeutic product not to try and achieve that type of goal. So
Yeah.
so I would implore those who are listening in the pharma industry to start working towards that, because it seems like such low hanging fruit for our patients to actually feel better while they're getting better as well.
Can I mention a brand name of drug?
Yeah, sure,
Yeah, I
sure,
mean,
sure.
I just think that like I don't think there's that many topicals that have done such a remarkable job, but Altrino is like one that
Okay.
stands out as um, they've really done a great job in repurposing an old medication, right? That was generic. And I remember when I was detailed about like tretinoin lotion, Altrino, I was like,
Yeah,
"You guys are out of your mind! Like, no one's going to buy this, right?"
yeah,
And then I got more and more like more and more senior in my practice, and I saw what my patients are doing,
yeah,
and they're not like they'll do tretinoin cream. It doesn't matter if it's covered by insurance or if it's if it's $20, and they'll spend the money to buy the alternative because they're actually going to use it,
mm-hmm,
right?
mm-hmm.
And I see what my patients do. I see what I call like the worried well. I see a lot of the worried
Mm-hmm.
well in New York City, and people who
Yeah,
have beautiful skin, access to everything, and I see what they use. And many of these products are not, we were not educated about them at all as dermatologists in training, and even as dermatologists in practice. And I'm talking about like the luxury skincare products that people will spend a lot of money on. And so
yeah.
there's definitely a room in the pharmaceutical industry to sensorialize their products and in ways to make people use them better.
Yeah, I mean, when we think about the luxury segment of skincare, which I know you and I have discussed this, we're talking about the La Mers and the La Prairie's and the Chantecailles and those kinds of brands. I mean, they've really taken that sensoriality and run with it, right? That's
Mhm.
kind of that's kind of the reason for use of those products in my view.
Yeah, I mean, they're masters at marketing as well,
Yeah.
right?
Hmm.
And that goes from print marketing to social media marketing to influencer marketing. And then, like
Hmm.
I said before, like people are attracted to the aesthetics of the packaging and the bottle. And so there's all that there. But, you know, there's a qualitatively different experience when someone's taking a drugstore product and they're pumping it out of that product of the bottle, and they're doing a luxury skincare and just feeling that instantaneously. It transports you into a different dimension, and you feel like you have access to that upper echelon of it's like a
Yeah.
reach. It's
Yeah.
for a lot of people it feels like a reach. I
Yeah.
always use the analogy of like young kids. Like I was a high school kid who was like trying to get back in my day. We were, I guess this was middle school. I wanted like the Reebok pump,
Oh yeah.
tennis, like Michael Chang
Oh
used to
yeah.
wear.
You pump the tongue of the shoe and it.
Yeah,
Yeah.
it was like
Okay.
all marketing, but it was like
Yeah.
super cool. And like, I had like summer job and I was like saving my money to get them. And like that was that's like not where you should be spending your money if you
Yeah.
have like not that much. But like kids do this now with Jordans all the time. And
Oh
I
yeah.
think in an analogous way, this is people's little experience of luxury is going for that skincare because they can be affiliated with something luxurious, something that's like, if you know, you know,
Hmm.
and something that definitely has that sensoriality, even if
Hmm.
the clinical claims are not there to back it up.
Apart from the kind of this neuro skincare idea, I see you post a lot on skincare on social media. What's your handle on Instagram, Evan?
Dr. Evan Reeder, DrevanRieder. Yeah.
There you go, Dr. Evan Reeder. Everybody follow him. He's great. He puts out some really good information, which is what we need. And you've been talking. I saw a post recently about a sunscreen that one of the L'Oreal brands that is available only over in Europe or ex-US, let me say. And you were really kind of harping on, look, these are great filters. The FDA is not working fast enough. We need to get better filters here in the US. And I think your message was really well taken because the filters that we have here are under suspicion by the FDA. They've required these companies to go back and do much more testing on age-old filters. In the meantime, we have all these kind of really broad spectrum, really stable filters that have been developed by primarily French and Spanish skincare brands that we don't even have access to in the United States. Of course, you could probably buy them on Amazon, although you never know what's inside the bottle when you buy something on Amazon, in my view. So buyer beware. But speak to that, and this one product. I think it was a La Roche-Posay product that you were looking at, that you were talking about. It wasn't anything that you were getting paid for. You were just saying, hey, I've been waiting for this product, and I'm really excited to review it. But apart from the actual product, just speak to kind of the sunscreen filters and the issues that we're having.
Yeah, I mean, I don't think it's probably news to anyone who's listened to this podcast, but our FDA, and I'm not part of the advocacy board for the American Academy of Dermatology, so I don't know what's going on behind the scenes, but
Mm-hmm.
it's sort of a paradoxical way, like the European committees, which seem to be more stringent about everything,
Everything, yeah.
right? Have
Uh-huh.
these superior filters that have made it through their stringent criteria. And I guess it's just not a priority of our FDA to get these filters put through our market. And I think that, you know, I'm sure that the topic of physical versus chemical sunscreens is one that you've gone over a lot
Mm-hmm.
in this
Yeah.
podcast, and I think both are great for different reasons. But there's a cosmetic elegance that comes with the chemical sunscreens that even in the best like nanoparticles, you just can't really necessarily get with those physical sunscreens. And I think it's a shame because there's people who want like the best. They want the best in
Yeah.
everything. Or there's people who have photosensitive dermatoses, or people who are living with melasma, or people who have skin cancer or immunosuppressed, who really want to do their best to minimize the amount of ultraviolet light that gets on their skin. And like these filters are not available to them. So a lot of my patients have the luxury of being able to travel. Again, like you said, there's gray marketplaces online and in person where you can buy them, and I think that's sort of a buyer beware
Uh-huh.
area. But I think it's a point of general frustration from like the esthetician, dermatologist, anyone working in the skincare community that has to do with these filters. And I think the FDA is being very cautious, but interestingly, like they keep eliminating some of the filters that we have available now, and for some of the reasons makes sense to me, and some of them seem to be politically driven.
Yeah. I think most dermatologists will say to patients, what's the best sunscreen? It's a sunscreen that you'll use, right? That's all we want, is for you to apply some sunscreen to your face. And whether it's a spray, a lotion, if it's a powder, if you're going to use it regularly, we're all for it. Okay. So, and what you're touching on is that historically the physical blockers have been cosmetically inelegant. They leave a white paste, they leave a white sheen. Even the nanoparticle ones are not perfect. Like the chemical sunscreens can really soak in and just apply a very nice matte finish to the skin, and they can be really quite cosmetically elegant. And the fact that the FDA is limiting us in terms of the spectrum of protection that we can get with our current filters is so shameful, because it's really affecting the incidence of skin cancer in this country, in my view, because we're just not able to use the products that we need to affect change in the population level.
Yeah, I think that there's a strong argument to be made for that. And I wish I knew what was going on behind the scenes, but I feel
I
like
know.
we were having the same conversation 10 years ago, you know?
Right. It's frustrating.
So yeah, I don't know what's getting in the way.
Yeah. So beyond the sunscreen, let's talk about kind of what are you seeing in skincare right now in terms of themes? What are you excited about, or are you excited about anything?
Um, yeah, I haven't been that excited about anything that I've seen on the market recently. What I've been meaning to do is to, in New York, we're lucky to have these gray market shops where they have
Yeah.
like K beauty. And so I have patients who go to these places who are like, you need to try XX products. And I have a whole
Yeah.
list of like K beauty products I need to try. But it's just everything's been sort of taking a backseat to childcare at this point because I have a
Yeah.
19-month-old. But have I seen anything that's been revolutionary in a while? Not really. I don't know.
Yeah.
Have you seen anything that has been so compelling to you?
It's a good question. I think companies are really trying to come up with products for skin lightening that
Yeah,
will obviate the need for hydroquinone, right? As we
yeah,
know,
yeah.
hydroquinone, the kind of the old adage of hydroquinone is that it's a tyrosinase inhibitor. It stops the enzymatic reaction that leads to pigment production. But what we know now is that hydroquinone is really toxic to the cells that produce pigment, to melanocytes. We're literally killing melanocytes with this drug, which could lead to all sorts of issues. And there's some data to show that hydroquinone may be related to skin cancer down the road. So I think these companies are trying to step in with novel ingredients and formulations. And one is Beiersdorf, which has come up with thiamidol, which is a really interesting lightening product. The other is L'Oreal La Roche Posay has come up with
No,
Melasil, which
yeah,
is also super interesting.
yeah.
And we've got Elastin with their peptide and other ingredient combination. So I think I'm all for that. I think that the companies that are really really working on ways for us to achieve lightening of the skin without the need for hydroquinone are doing some really wonderful and important work.
I totally agree with that. I was familiar with Melissa, but I wasn't familiar with the other SKUs. And I think that, just clinically witnessing the damage that happens with hydroquinone or
Yeah,
hydroquinone compound products. And because
yeah,
sometimes like people will get priced out of the triluma, which is
yeah,
the tretinoin, hydroquinone, steroid combination. It can be pretty expensive, and people then go into a compound pharmacy, and then often you don't know what you're getting from batch to batch, right? And then
yeah,
I've seen all sorts of irritation reactions, and so much so that like I won't use those compounding pharmacies anymore because I feel like the quality control is so variable.
yeah.
But that's it's just like a major area of need, and I think in general, anytime someone enters the market with something that's said they're going to lighten pigment, or when people are asking me about pigment lightening with OTC,
Yeah.
it's I always have to be very careful with my words because I feel like the options that we have had on the market thus far have been woefully inadequate despite what
Right.
drug companies, or pharmaceutical or skincare companies want people to think.
Yeah, I mean, I think it's getting to the point now, Evan, that when I see a patient with melasma or with just photo damage that requires some lightening, I'm really trying to integrate these OTC products along with some of the more prestige products that we carry in our office to try and go at the melanin pathway from all different angles. We're including tranexamic acid systemically,
Yeah.
topically, and then try and include. I mean, it's kind of amazing now that we can attack the reaction that produces melanin in so many different ways. And I think we just, as dermatologists, we need to start really taking a look at these OTC products. They're not super expensive. They have clinicals to show efficacy. They can be easily incorporated in a skincare regimen. And if you really look at it, you can kind of look at the enzymatic reaction and target a product for each step. So it medically makes sense to me to
Yeah.
start working at it that way.
And I also think that the way that you articulated that is really important. One thing that I've seen in skincare, and I would love to hear your opinion on this. I'm not a cosmetic chemist, but I've seen this trend
Right.
towards it's not really coming from like skincare companies. This is coming from startups or sometimes even individuals making their own skincare where they said this is packed full of ingredients. And you can to target one step and one molecule with one skincare SKU. I think makes the most sense, and like I think you're going to lose efficacy when you're trying to pack 20 ingredients into a single SKU. And I think a lot of people, I'm sure people listening to this are informed about that, but a lot of the general public doesn't know that, and they think they can do it all in one.
Yeah, I think that brings up a whole nother conversation about kind of the Swiss Army knife products, right? The products that have so many different ingredients and have so many claims that they can essentially it's a brand new face in one bottle.
Yeah.
And I think we just, 5 years ago, I would have said, let's do it. That sounds amazing. But now that I'm, kind of understand a little bit more about formulation and cosmetic chemistry, and I've spoken to these people that kind of really integrate the ingredients into formulas, I understand that's really not real. And to your point, they just can't achieve everything they're trying to achieve with those kinds of ingredient combinations. I mean, there's so much to really think about in terms of formulation and what plays well with what and what pH works and what pH doesn't work, and there's just so much to think about.
Yeah, and I think that's another place where like it sounds good from a marketing perspective, and for the average consumer who doesn't know what they're doing, or sometimes even but someone who's a dermatologist who's not going to look at the literature, you can say that you have
Yeah.
clinicals, and then but what are the outcomes that you're looking at? How's the study done? How, there's so many different variables that go into it that it takes a
Mm-hmm.
pretty sophisticated mind, or at least someone who's being very careful about reviewing their product data to actually understand if this is a product worth using or not, or if this is all marketing spin.
Yeah, perfect. Well, that's a great place for us to end here. I mean, it always goes by so quickly. I've really enjoyed this, Evan. Thank you again for your time. I know you're super busy with that baby, so thank you so much. Everybody, this is Dr. Ted Lane. You're listening to Skincare Confidential. We just finished up an interview with Dr. Evan Reider. His Instagram handle is Dr. DREVANRIEDER and please follow him. Otherwise, we appreciate you listening to the podcast. Please subscribe and share. And, till next time, thank you so much.